Hi, I'm Brandon Leonard with Men's Health Network, and I'm here in Washington, D.C. at the Dialogue on Men's Health series, discussing strategies and initiatives to improve men's and boys' health throughout the lifespan. Today I have the pleasure of speaking with Dr. Gregory Pecchia, who is a family physician and geriatrician, as well as a physician educator at the Eisenhower Medical Center in Rancho Mirage, California. And in addition, Dr. Pecchia is a 30-year member of the American Osteopathic Association and is representing the AOA to the Men's Health Dialogue today. So welcome, Dr. Pecchia.
Nice to be here. Thank you.
Thank you. Could you start out by telling us a little bit about AOA's new initiative around male health?
Well, it started about 3 years ago with the former AOA president, Peter Ageluni, who announced an initiative in that regard generally. And over the past few years, that's codified into a number of initiatives that predominantly wrap around some of the resources through the Men's Health Network, public-private partnerships, and really a vision for the American Osteopathic Association to pull through some of those resources to our membership and eventually for implementation into our clinical medicine and our training programs for future physicians.
Okay. And where would you like to see this initiative in, say, 5 years?
My personal bias is that we find a way to really implement the components of men's health that are evidence-based, that can lead to better outcomes for men, better outcomes for families, better outcomes for children of men, and better outcomes for our communities.
Okay. How do you think physicians and clinics make boys and men feel more comfortable when they're visiting a physician, or how could they improve on that?
You know, leveraging the differences between men and women, which from a clinician standpoint really focus around the fact that confronting men directly about healthcare problems and health issues sometimes doesn't generate the desired outcome, but rather laying out an array of options for them to begin to connect to healthcare, understand healthcare as not only a disease-oriented system to which one accesses when they're having pain or a medical issue, but to access it as well for wellness, prevention, and early detection.
Okay. Do you see a place for more or better training for physicians on how to communicate effectively with men and boys that they see in their practices?
Absolutely, and I think our profession focuses on that in our training, the personal aspects, the doctor-patient relationship, and now with social was the focus on access. Now that we have momentum through the healthcare.gov ACA initiative, my initial observations in the field have been that access is really an issue. I have a lot of